Hello everyone, you're welcome to today's workshop. To start with, I'll have to present myself. My name is Bamitale Oladumiye. I'm going to be the person to present the workshop for you. Now as participants, we have to determine the needs of the workshop. This workshop actually is on prevention of malaria in pregnancy. And we're going to have ground rules. We all know that we are adults, and there must be ground rules to guide the workshop. The first ground rule will be you are all going to put your phone on silent mode so as to prevent distraction. And the next one is that there shouldn't be any multiple answer. You know, you have to answer a question or you need to ask a question, you need to signify. And for the workshop, we are going to be in pairs for us to be able to have an effective learning. And we are going to pair up in twos. Pairing up will help us to know each other the more, and will help us to be able to know more about the learning workshop. Then you will become friends. For us to achieve this, each one of us will introduce yourself to your friend. You'll tell your friend your name, your hobby, the food that you like, and your goal in this workshop. To start with, my best food is pounded yam with egusi soup. And my hobby is traveling. I love to travel a lot. So I would like you to introduce yourself to your friend. Thank you for doing this. Let's move on to the next slide. Well, the topic of the workshop is malaria and pregnancy prevention, which is MiPP. Pregnancy, as you know, has to do with women and women of childbearing age from age 18 to 49 years. And when we talk about malaria, the causative agent for malaria is mosquito. And mosquito help to transmit Plasmodium falciparum to an individual. And this is done by biting the individual. And in the process, malaria is transmitted. There are lots of effects on malaria affecting the pregnant woman. And that is why it needs to be prevented. And that's the reason we have this workshop. We need to know the objective of the workshop. And we should know that the goal of the workshop is for the health personnel, as you are here, to reduce maternal and neonatal mortality. After completing this workshop, you should be able to identify eligible pregnant women by using the appropriate checklist that will be given to you. And there are two levels of objective concerning this workshop. The level 1 objective is that you will be able to prevent and control malaria in pregnancy. That's just the goal. The moment you prevent malaria in pregnancy, you are reducing maternal and neonatal mortality. You should be able to list adverse consequences of malaria in pregnancy. Then you should be able to enumerate World Health Organization recommendations for the control of malaria in pregnancy. You should be able to counsel pregnant women about the benefits of sleeping under insecticidal nets, and also provide intermittent preventive therapy with sulfadoxine-pyrimethamine to eligible pregnant women. Importance of malaria in pregnancy. Malaria in pregnancy has a global burden on a pregnant woman. There are some facts about malaria. 300 million cases each year worldwide are being affected by malaria. 9 of 10 cases occur in Africa. A person in Africa dies of malaria every 10 seconds. Women and young children are most at risk. The adverse effects of malaria in pregnancy. 50 million women are pregnant yearly in malaria endemic areas. Malaria is more frequent and complicated during pregnancy. In malaria endemic areas, malaria during pregnancy may account for up to 15% of maternal anemia, 5 to 14% of low birth weight, 30% of preventable low birth weight. And if we are going to discuss this, we now move on recommended approaches to prevent malaria in pregnancy. And with this, we have the WHO recommended approaches in preventing malaria in pregnancy. It is observed and known that antenatal care is very, very effective for a pregnant woman to be able to achieve positive pregnancy. WHO, that is World Health Organization, now confirms and stated that 8 antenatal visits must be carried out for a pregnant woman to be able to achieve a positive pregnancy. For us to know if a woman is pregnant, the first thing that will be complained of is missed periods, popularly known as amenorrhea. And you now find the pregnant woman having morning sickness, that is presenting with nausea and vomiting. There will be fatigue or weakness. Those are the complaints or symptoms of malaria. And to furthermore stressed for us to be able to identify a pregnant woman, we find the woman complaining of breast changes, that is fullness of the breast accompanied with pain, urinary symptoms, which is frequency in micturition, then feeling of pressure, constipation, and enlarged abdomen, in which the uterus will be enlarged. We can carry out pregnancy tests to be able to determine if the woman is pregnant or not. And the moment we identify that a woman is pregnant, we need to encourage the woman to go for antenatal care. And the woman will have to visit the clinic and be registered for antenatal care, which will be conducted by a registered nurse, a registered midwife. Then there are steps of control of malaria in pregnancy. Malaria is usually caused by mosquito bites, in which there's transmission of Plasmodium falciparum to the woman, the pregnant woman. And for us to control malaria in pregnancy, the pregnant woman is encouraged or advised to sleep inside treated mosquito bed nets, and which has about 52% coverage in the year 2019. And also to take pyrimethamine, sulfadoxine-pyrimethamine, which is just 3 tablets that will be taken monthly. And a woman is encouraged to take at least 3 doses of this. With this, malaria will be prevented during pregnancy. With sulfadoxine-pyrimethamine, you're going to have 34% coverage. And totaling, we have to prevent a pregnant woman from having malaria in pregnancy. The benefits of malaria in pregnancy is that you are going to have a lovely baby, the family will be happy, and every one of us will be happy. I believe you all understood everything. If there's any question, you can ask the question. Thank you for listening and for participating.